afternoon. My name is Leslie McDonald, and I want to welcome you on behalf of the CASA Child, Adolescent, and Family Mental Health to another edition of our live streaming event of the pandemic's impact on mental health web series. We are coming to you from my home office. Previously, we were located in the CASA Center, but because of the pandemic and the social distancing, we thought it was best to go back on the web. This is obviously, these are unprecedented times. People have a lot of questions. There's a lot of anxiety. And we decided that if you can't come to CASA, then CASA was going to come to you with reliable, accurate information. For those of you who don't know, CASA is a nonprofit organization providing assessments and treatment for children and families in Alberta for more than 30 years. And you can learn more about CASA on the CASA website. We want to thank our partners in this series, the Institute of Health Economics, the University of Alberta, the Edmonton Public School Board, and the Alberta Alliance on Mental Illness and Mental Health. We began having these public forum discussions with the Dr. Roger Bland series. It's a monthly series, a live event. It's been running for 2 years now, and our goal has been to inspire dialogue, hope, and wisdom, and to reduce the stigma faced by people with mental health issues. And we're going to continue that conversation and learning by taking it online with this web series. Our topic today is a parent's perspective on the impact of the pandemic on mental health. And our guest is Candace Fehr. Candace is a parent with lived experience navigating our mental health systemic system. She is also co-chair of CASA's Family Advisory Board, and professionally, she's a social worker with Sturgeon Public Schools. Welcome, Candace. So delighted to have you here. I want to start off with your background, which is quite fascinating because it's quite varied. First of all, let's talk about your work as a social worker. Tell me about your breadth of experience and some of the things that you've seen. I'm sure that some of that's been coming back to you loud and clear with this pandemic.
With respects to social work, yeah, I've worked in human services in some form or another for over 20 years. But with respects to social work, I'm fairly new to that, about 5 years. Yeah, certainly some of the things that I am seeing are just day-to-day struggles for some of our families with the complexities of where things are at right now. So.
Mm-hmm. What have you seen in the past with your experience as a social worker that are really coming into play now?
I think more than ever, there's always an awareness if I take this to mental health and the yes. passion work that I do with CASA. Yep. There's always this awareness that families are impacted on a daily basis in some way, shape, or form when yes. it comes to mental wellness. We all need to be on top of that, right? Looking care after that. But with respects to what I see now with families, it's just another layer that we have here. So I think in retrospect and thinking about this, it's a pandemic right now. It's a crisis, but the days go on and our daily living goes on. And yeah. So much like when we are living through mental health crises or interventions as a family, we need to find these ways to balance that day-to-day living on top of the complexities or the unknowns, if you may. So some of the families that I have the pleasure of working with, are military families right now who maybe are very isolated beyond this social isolation that we're experiencing, really here in our city with not a lot of family support, if you may. Single families, blended families, foster families, kinship families, you name it, just a lot of diversity in our beautiful city, but certainly with this pandemic now, this crisis, we're just dealing with more. And so I'm really excited to talk to you today about, maybe how we can do that. And from a perspective of a parent with lived experience, yeah.
Yeah, let's talk about that. Parent with lived experience, because it's really important that you've been through the system firsthand, and you've had you've been dealing, or you did deal with this as a parent. It's been a real light at the other end of the tunnel. But can you share what that lived experience has been for you?
Yeah. So when my daughter was a teenager, preteen, we did have a disruption in our family. I was going through a divorce, and some of the things that we dealt with through that separation of family were mental health, wellness concerns. And so
Yeah.
for my daughter, when she was younger, she had moments of suicidal ideation, attempts, and just struggling a lot. Her concerns were trauma based, and so I started seeking out appropriate help. And CASA is where I found my family and I to be. And that was back in 2013, give or take.
Yeah.
From our lived experience, Leslie, something great was created, and that was the Family Advisory Council at CASA that you mentioned. So we started that in 2014 as a group of parents with lived experience. And ironically, although we all have different backgrounds, a lot of our stories are the same when it comes to the barriers of accessing care for our loved ones.
Okay, and this is all background to give us some perspective as we move forward, because you and I talked about how before the pandemic, 1 in 5 people had some challenges sometimes with mental health, and now, holy cow, it's the vast, it's reached out. It's a huge chunk of the population.
Yeah.
Um, yeah, what are you seeing with the Family Advisory Council? What are you seeing with parents with what they're going through?
Oh, that's a great question. So we recently had our meeting, our monthly meeting via teleconference as well,
Yeah.
so remotely. And I know my council would be all right with me sharing that just amongst the 10 to 12 of us, the diversity is quite intense. We have grandparents who are raising their
Yeah.
grandchildren. So, stopping to think about the impacts of that. What does that mean when you're 65, 70, and you're now full-time caregiver at home, with your youth or the child that you're caregiving for? Foster families, blended families, single parent families such as myself. Yeah, just a variety. And so I really hope that today's message just helps to bring awareness to the differences in families and the differences in the complexities that we're facing.
Yeah, so if you've got families who are already complex or already dealing with issues, then it must be multiplied with what we're going through now with a pandemic. I guess I'm thinking about people who are already challenged with coping day to day, and how this pandemic must be affecting them.
Yeah, interestingly enough, and I would always validate that there may be some of us who are having challenges dealing with this right now. I wouldn't invalidate that. But here's the thing about going through mental health crises. Some of us are very accustomed to living day to day, and some of us are very accustomed to prioritizing what matters the most in our families. And sometimes that's not what the norm of maybe society would say at the time. So for example, schooling. I work within school division. I support academics through and through, but it's not a time to be overly concerned about that with our families, because of these extra complexities. And going back to your 1 in 5, Leslie, if you've never experienced, say, anxiety before until now, because something tipped your base level over just a little bit, and now you are experiencing having to deal with your own mental wellness concerns, how scary that is.
Mm-hmm.
It's terrifying. So I can put myself back there in the moment of crises, back in 2013, and I've thought a lot about what would my parenting be like right now if I was going through that crisis on top of this pandemic. That's scary. That's scary. Yeah.
You know,
And
you
so
said,
what,
go ahead.
I was just going to say, so what we offer those of us with the experience of sitting in crises at times, our gift is to offer this resiliency, this intergenerational resiliency that we have spoken about at CASA and the lecture series. I think it was Amber Dion who made some wonderful remarks about that.
So what did Amber talk about? Refresh us on what that thing was that really stuck with you when he spoke. This is from the Dr. Roger Bland lecture series.
Yeah, and well, Amber Dion is a beautiful Indigenous lady who spoke a lot about the awareness of not only intergenerational trauma, which we validate and understand a lot about, but now this awareness to intergenerational resiliency. And again, with lived experience, I think that's a state where my family and I are. We are resilient now. It took a lot to get to there. But again, along with this data crises or these complexities that we're going through, I have a full belief that there will be good for families that come up.
So what is that resiliency? What is that resiliency that you've learned that you use now? When I talked to you yesterday, you said you've almost felt guilty for actually not struggling as much as other people with what's been going on. And so you've been using that resiliency has really come into play for you. What does that look like?
Yeah, so thank you. That's a beautiful question. And with great transparency, it looks like putting relationships first in my home. Always. Anything that I do as a parent or a caregiver, when it comes to the people in my home that I care about or care for, I always ask myself, where is this in relationship? What does this do for relationships? So going back to these complexities, if you are a parent trying to set up a home office, starting to try to work your 8 hours a day on top of little ones running around, that's complex, right? And we need to be, again, aware of these things that families are going through.
So what are you doing that's different?
Well, for us, doing a lot of exercise. So part of my journey in lived experience is the recognition that I need to exercise for the release, for the stress, the release. And I'm really happy to say that that's something that my daughter and I now enjoy together. But to counteract that, we also are a bunch of foodies in our home. So we're currently making a lot of good, possibly high-fat food, but we exercise that.
We're all going to have to deal with that after this is over, because we're enjoying meals in ways that maybe we didn't have time for before.
Right?
I figured I'm spending a couple of hours a day in the kitchen cooking. It's been
Yeah.
fun. Yeah, and it's I guess, Candace, it's a different way of looking at things, because we've got so much negativity coming at us. You can't ignore the news. You have to know what's going on, but it really does have an impact on our mental health and how we feel. And it's finding those ways to be resilient and to get perspective so that we're not bogged down, so we don't get depressed. It's like Chicken Little, the sky is falling.
Yeah, and that is, sometimes, again, in lived experience, where those of us that are blessed enough to have support systems, where we really need to reach out, and a shout out to our council at Family Advisory and any family through CASA that, again, has experience going through these mental health crises for our youth and children. Now more than ever, we can assist. We can support families because, again, these things aren't going to stop in light of pandemic. So somewhere in Edmonton today is a parent struggling with their 12-year-old who, maybe isn't in the best place. So again, we need to make sure that those messages of suspending judgment at times and opening up spaces for people to talk.
So let's go back to the parent council and the conversations that you've been having about how people that have been coping and some things that have been working for them. Can you share some of that?
So within our council, we did do a bit of a debrief, if you may, as to how this is all impacting our individual families. And it's amazing, again, the intergenerational resiliency. There's so many things that families are doing, from, heading outside to hang out together. Again, though, to being able to just open space. When things are really tough in families, I like to remind myself and others that less is more. So if we don't know where to go as a parent or what to do, that's okay. Right now, that's okay. Just be with your children, right? So some of the council members have said exactly that. We have one council member who is a foster parent, I believe, to 7 children.
Holy cow.
Yeah. Wow. Yeah, and some might be some of her bio, but you know what? You talk to her, they're all her kids. It doesn't matter. But 7, right? And so how does she deal with it? Exactly the things that I've been recounting, which come from our council. Prioritize the stuff that matters and let the rest go, especially right now.
Yeah, it's when you've got people who are used to being independent, and teenagers in particular, they're used to being outside the house. They're only home for certain things. People start to get a little antsy and tempers start to flare. And, particularly young people, they feel very, very cooped up. Do you have any advice or insight into that about what people can do, how they can think, what perspective that people can have?
I think if this might be a little deep for me, but I think if this was 10 years ago, I would be feeling in my home, what do I do with myself, and how do I fill my time? But there's a peace that comes with that inner stillness. And so again, and maybe we're not all there, and I appreciate that, but I find that I'm trying not to stress about filling my time. Again, what I'm trying to remember is to realign my relationships in my home and put my energy there. Because when push comes to shove, that's all that matters, right? That's all that matters, is the relationships that we have here. So if things are getting tense, step back, take a breather, take a day off if you can. Let our little ones maybe have a day off,
One of the things that we talked about with the whole lived experience thing is the fact that when you've been through some really, really, really tough times and you come out the other end, you realize that, while you're going through it, it feels like that's the end of the world. But when you come out the other end, you are a better person for it. You learn things. It becomes a positive if you let it.
Yeah. The hard part about that, Leslie, is digesting that while you're in the belly of the beast, if you may. Right? Yes. So just like so many amongst us, it's not until you're through the journey that you can look back and reflect and go, oh. And so that's where part of that survivor's guilt that you say, that's where my daughter and I are particularly, and my son, we can look at these crises moments and go, but here's the gold nugget in that. Here's what grew us as a family. But it takes time to get there sometimes.
Yeah. What did you learn? What did you learn?
That I know nothing. That I know nothing. Really and seriously, when it comes, like, all I know is about me, and even applying that to my own children, which is hard because as parents, we only want the best for them. And this concept that they're not a possession of ours is a hard concept at times. They're born to us as babes. We look after them. We do everything, rightfully so. But at least in lived experience with mental health, there comes a time where you have to let go, and that person becomes their own person. And I think that was the best gift, because my early style of parenting, I may still be unable to let go. and where would my children be now? You've met them. They're amazing. They're doing amazing things, but they've had their own journeys alongside of me to get there, right?
Mm-hmm.
Yeah.
How do you let go in a situation like this where it's in your face every day, constantly?
Yeah, again, great question, because I think that comes with that intergenerational resilience piece, or resiliency within your family. You may not be able to begin with, but like you identified, and I've said, with the daily routines going on, things still happening for families, babies being born, for example, you practice, you keep practicing. Yeah.
Practice, I guess I'm thinking, and maybe this is sort of outside a bit of your area of expertise, but I'm thinking about, I've got a daughter in Sydney, Australia. I've got a son in Toronto. I've got a mother in Toronto. My mother's on her own. I worry she's 86, if anything happened to her, I wouldn't be able to be with her. Does she have enough support? There were more deaths from that long-term care facility in Calgary today, and there's a lot of worries about things that are outside of our control. There's one thing to have families in your home, but there are also maybe families who are just stuck overseas. How do we cope with that? How do we settle that anxiety about things that we can do nothing about?
Yeah, again, a question that I have very much reflected on, and have in my notes, that for some families, just an awareness, and again, a validation that there's nothing really that can be said to bring ease to some of those worries. But what we can do as community, and what I can offer even yourself, Leslie, through relationship, is opening up a safe space. And what we know in terms of mental health wellness is that if I reach out to somebody else whom I can trust, and I can share some of this stuff, I am taking a step in the right direction. It doesn't mean it eradicates the complexities of my families per se, but it allows me to know that someone out there cares. Someone out there is understanding. And again, I go back to those of us that are offering support. We don't need to say anything particularly. We just need to open space, just like CASA's doing right now on these lecture series. Right?
On these lecture series. And that's the thing, is that really what it comes down to. It's not necessarily a magic bullet or a top 10 list. It's about community and about relationships. And that's how we're going to get through this. Is that how you feel?
I do. I absolutely do. Yeah. And I think that our community, Edmonton and area, Alberta, if you may, we're already hearing a lot of stories of examples of kindness and people going out of their way. I think we'll see more of that. My hope, Leslie, and I know this was something I shared with you on the phone, was that after the dust settles, when this pandemic passes, as it will, that kindness and that awareness in community to those of us who may struggle beyond this crisis, this pandemic, that kindness continues and stays in our community. It's very much needed.
It is inspiring, actually, to see what's going on and how people are jumping in to help. And this is live, and I can see Jeff, who is our producer on this. Jeff, do we have any calls or any emails coming in from people with questions? Because we'd like this to be part of a dialogue. Actually, we'd like to even hear stories of what people are going through.
That would be great.
Yes. Yes. Okay, so you can take your questions into the chat on live stream, that's the dialogue that I was getting from Jeff, which is why I was quiet for a minute, even though you can't hear. But we'd love to hear from you, either with your questions or your comments or anything like that. Honestly, Candace and I could talk for hours about this subject and about mental health things, but we'd really like to hear if you have any questions as well. We'd love to have you join in on the dialogue. So one of the things that we didn't talk about, Candace, is, children are resilient. We're going to be speaking with your daughter actually on Thursday. Victoria is an amazing human being. I am so impressed. When I saw her speak at CASA, she made me cry. She touches me. And, when you look at what she's come through, what she's gone through to where she is now, it just shows you how incredibly resilient children are and how they adapt.
Absolutely. Yeah, I think families as a whole are very resilient. My and I think many social workers would stand behind me. It's that the most marginalized amongst us are the most giving and at times the most kind, because there's an awareness of what it means, again, to live with barriers or complexities. And so when you have that awareness, we tend to be a lot more empathetic towards other people, right?
So
I just want to mention too, with respects to schooling, I'm getting a lot of families or parents who are concerned about children missing school right now. And just another left piece for me, with respects to my daughter, whom you've identified as amazing, I agree. She missed her entire grade 8 year due to her mental health illness at the time, and still was able to graduate and is attending university. And so I guess it's, again, just that lived awareness piece that we can go without sometimes and still be successful, still come out the other side. Okay.
So what did you learn from being a parent and seeing the struggles that she went through? What have you learned about resiliency through watching her?
Well, with respects to going back to the academic piece and schooling, I would identify that when she was missing her grade 8 year or that year of schooling, I felt a lot of pressure as a parent, and I felt that maybe I myself might be judged because she wasn't getting the adequate education. She was actually hospitalized for most of her grade 8 year. And I thought, wow, as a parent, as a caregiver, is this the end of her future? And again, it wasn't. So what I learned was that, again, in the moment, what we think can be so big and huge, if we can sit with it, create space, remember relationships in our families, that crises will pass, and we're still there, and we're still together, and that's what matters, Leslie.
As a parent perspective, it's never the other end. It's never the end of the tunnel. It's like a continuum. And what are some of the consistencies that you went through, that you've seen that other parents have gone through in those challenges that we can learn from?
I think that concept, again, of letting go. It's really hard. Yeah, really hard concept.
Yeah.
What does
that look like?
And I mean, we can apply that. It's a broad statement, can be applied to so many things, but narrowing it to parenting, narrowing it to our families, letting go is the best advice I ever got from a CASA staff. Going through crises with my daughter was, don't go down the rabbit hole. And I thought, what does that mean? And I went home and I queried it, and I thought, oh, and what that well-intentioned therapist was trying to tell me was, that is her journey. You got to let go a bit, and you still have to remain intact here and help from here. As a parent, that's so hard. As a social worker in community, oh girl, I got that. That's in the hat. But as a parent, that's a different story, right?
Yeah. The mask, right? The thing they always tell you on the airplane is that you should put the mask on yourself, because you can't help anyone if you're not taking care of yourself. What does that look like? What did that look like for you?
It looked like losing control a lot in the beginning of our journey.
Yeah.
because I had so many questions I just couldn't find the answers to.
Yes.
And to this day, I still don't have answers to those questions. And that's part of letting go. You know, I'm
Yeah.
okay now with not having answers to some of the questions that I had. But in the beginning, yeah, lots of loss of control, lots of appointments, meetings with, help services or health services providers where I did not show up my best self. Not at all. Too much stress, you know? Again, the complexities of family. If I myself am a parent that comes from a trauma background or struggles, I have to take that in consideration in helping and caregiving for my now youth who is struggling. And on top of that, in lived experience, as you know, Leslie, a son who decided that he needed a pacemaker at some point in all of this crises. So we had this physical illness and mental health illness in family, just balancing it all. And the saying goes, you have to fall, crumble to build back up, right? And so,
Yeah.
yeah.
And when you fall, you learn how to build back up. It becomes a muscle that you start to use. What do you think, people? We are just at the very beginning of this. We haven't even hit the worst part of where this pandemic is probably going. And so maybe it's premature to talk about the other end, but it's also important to step back and look at what potential good could come out of this. That'll help us go through the really tough times, to be more philosophical, because we can't do anything about it. It's what you talked about. We're helpless that way. We can only do what we can do.
Yeah, absolutely. And I think that looks so different for all of us, right? The good that can come out of this for some families may be the love of finding a new game that they like to, play together. For other families, the good that comes out of this is again, we made it through a day without arguing. We made it through a day where I can say to you, I want to share my space with you because I'm in a space myself that I can handle that, right? So again, it's about relationship. If we're finding at home that things are stressing us out, such as teaching our children their grade level curriculum right now, it's okay to just park it and let it go for a bit. And that's my main message, because I know that sometimes we need to be given permission to be ourselves. So, yeah.
Yeah. And just to, I guess for us, it's been about, like you, it's been about taking daily walks. I'm thinking, wow, I might actually have time to read a book, which I never get to do. It's what kind of projects? Writers. I've been talking to writers who talk about how this is an opportunity for them to start working on their book. Start looking at life in a different way and looking at families in different ways too. Relationships, building relationships just by being.
Yeah, and I'm not sure, again, I validate what you're saying. Who knows where this will go? We hear that the worst of this pandemic is yet to come. But I think that at some point, some of us might find ourselves being pulled to community work, volunteer work as well, because if we're reading and keeping up with the news, certainly there seems to be this underlying message that there may come a time when we're all asked to do something. And again, that's great. That's good in community. That's what we need.
Yeah. So what good is going to come out of this for you?
Well, the irony of it is I never thought in my parenting lifetime I would be living through a pandemic. I think what's going to come out of it for me is the story to say, hey, we made it through this as well, and there's been these conversations, these beautiful conversations in my home where we're talking openly about how is this impacting us, this COVID-19? What are the changes coming that we may need to be prepared for? And my youth in my home, my daughter and my son, both have said, we got this, Mom. This is not the first time we've had this kind of stress. And so again, I think that's our gift, the families that have lived through any type of crises or trauma. We can pass on to other families the "we got this" mentality. And that comes with practice. It's not a innate. We need to support and guide our families in that direction. So.
Wow, that's beautiful. Jeff, do we have any people, any questions? Okay. Okay. Um, one of the things I love, Candace, is how calm you are about all of this as we move through. And I guess whether or not you have any final words before we close things off, any final things that you'd like to leave the audience with?
I think just that really clear message again that the Family Advisory Council and CASA have a great awareness to the fact that families are diverse and come in all kinds of packages.
Yes.
And that, this emergency now in our community will impact all of us in various different ways. But to those of us, those families and community who are new to mental health crises, or just, again, seeking out appropriate and timely care for their children or youth. The chances of getting that care now are harder than ever. There were barriers before, but now, just given to where things are at, accessing that may be harder than ever. So if you're stuck, if you don't know what to do as a parent in these high crisis times, again, I just want to say open space. Lay with your child, sit with your child, and do nothing. If that's the best you have, then stay with that. And again, always relationship. Sometimes less.
Yeah, we're not making money, but we're not spending it either. Hopefully.
And some of us are okay with that because, some of us don't have that option anyhow. So, right? Like, again, the complexities for families, I can't even begin to say, oh, everybody will be okay, because I have no awareness to that. But I know that as a community member, I will extend myself, and my youth in my home are willing to extend themselves to anybody who needs that safe space opened up. We can do that. Mm-hmm.
And to do what we can, I've been doing Woman of Vision. I've been interviewing for 38 years, and I've been doing Woman of Vision for 25. We had to cancel our 25th anniversary event, not cancel it, we had to postpone it. But one of the things that I've learned from seeing interviews over and over again is that basically, human beings, we have a need to feel that somehow this world is better because we were a part of it. And that's an opportunity during a time like this, during a crisis like this, where, we sort of set aside our own challenges because there's only so much that we can do. And what can we do to be of service? How can we help? And it doesn't have to be going out and changing the world. It can be right in our own homes, with our own families, with our friends, with the people that we care about, the little things that we can do to make a difference during a time like this, and how that can impact our own mental health, as well as the mental health of the people around us.
Agreed, Leslie. Absolutely. Yeah.
Yeah.
It starts with us, right? And then within our own homes, and then we can move that out to community. But again, some of us, depending on where we are in our journey, may not be able to extend too much of themselves. And that's okay, because we're here, community's here. And the hope is that we don't let anybody slide, right?
Yes. Candace, thank you so much. Really appreciate your being here for our first sort of, webcast from our home. And always wonderful talking with you. Thank you so much. And we'd had Candace Fehr. And if you'd like to support CASA and their work with infants and children and families and youth, you can text CASA to 393939 for information on how to donate. And we're so appreciative. so appreciative of all donations. Charities are in a real tough spot during this time, and everyone is. And so anything you can give to support makes a big difference. And of course, you can learn more about CASA on our website at casaservices.org. There are resources there for you to be able to tap into. This version of the live streaming event, and all of our live streaming events are taped, so you're going to be able to see them on the CASA website. We are going to continue with our web series on Thursday at 2:30. We are going to be speaking to the youth perspective on this pandemic and the impact on mental health. So stay tuned now at 2:30. For the daily coronavirus update with Dr. Dina Hinshaw, Alberta's Chief Medical Officer of Health, and that's at alberta.ca. So thank you for tuning in. We hope to see more of you, and we hope to hear more of your questions coming up on Thursday. In the meantime, please take care of yourself. Good afternoon.